Hello, everyone. We're just going to begin in just a second once we have everyone kind of logging into the webinar here. Okay, hello everyone. We're going to go ahead and get started here. Today, you are joining us for our Fairfax Cryobank webinar of the month. And on our Pride Month, we're doing a webinar today to go over LGBTQ plus family building with donor Sperm. And next, Christina.
Hi.
You go to the next slide and we can go ahead.
All right. There we go.
So today we're joined by Christina Garcia, our cryobank manager, and she's going to go through the first part, talking through the donor sperm overview, followed by Kate Wista, who is joining us for the insemination portion. And then Doreen, who is here as well, she will be joining us for the Q&A for the client services part. And then I'm your moderator from the marketing team. If you have questions today, please go ahead and put them into the webinar sidebar, the toolbar, whatever it looks like. You can go ahead and submit them throughout the presentation as they come to your mind, but we'll get to them at the end. We do have a full section for Q&A at the end of the webinar. In addition, today's webinar is going to be recorded and emailed out. So if you aren't able to join us for the full webinar, don't worry, we'll send out a recording shortly today. And now I'm going to pass it over to Christina.
All right. Hi, everyone. Again, I'm Christina Garcia, and I am the Cryobank Manager for Fairfax Cryobank. I am going to get started and do an overview of the donor screening and the process and the profiles, etc. So let's get started. To be on the same page with everyone, I just want to make sure that we need 3 things to get started and make a baby. We need eggs, sperm, and a uterus. So eggs and sperm, you can either use yourself, a partner, or a donor. The uterus can actually be yourself, a partner, or a gestational carrier, or a surrogate. So our different options of building a queer family is either you can use your donor egg, sperm donor, and known or directed donor, egg or sperm. So the process is a little bit different from using a programmed donor, but it's very similar as far as like medical information and testing. It's just that it has different types of paperwork, and you can always contact client services to acquire that information. Trans individuals can bank their eggs and sperm prior to transitioning for the fertility preservation. And then when you're ready to use it, your gametes, you can simply give us a call, and then we can ship it to your clinic, or if you want to do it at home, depending if you're available to do it at home, we could process that, and then you can use it for your sexual intimate partner, or you can use it as well as the different option is a surrogate or gestational carrier. Other option is also adoption. Okay, so being a donor is actually quite hard in being accepted. Approximately 1 out of 200 donors from the initial applications are accepted into the program. The donor screening entails a very rigorous process. So first of all, they'll go to our website, apply online, which they'll provide their information or their medical application, which is very extenuous, and it's 3 to 4 generations of medical history. The 4th generation, some of our donors actually have their own children, so that's what we consider as their 4th generation. Once they've applied and they're accepted to come to the office and make their screenings, they'll have 3 to 4 screen samples, which our laboratory will determine whether if their specimen quality even is approved. So if they have their semen samples are high quality and they're good to go, their third initial appointment will be background checks. We do a PAI, which is a psychological assessment index, and that we have a medical provider who will do the assessment for psychopathologies, which including with mental disorders, etc. Our lab will also do an interview with trained staff members. So they will do a full extended interview, which they'll go over their medical profile, and they'll also, get to know the donors, making sure that their answers are accurate, and then they will determine and write down any notes that are any changes to their medical profile, as well as going over through the whole program with them. Once that is determined, we submit all of our information to our medical committee, and they'll determine whether they're approved to the next step or not. So then we also do double verification with their ID. So every time they come into the office, we'll verify their ID, as well as the laboratory will verify them as well. Eligibility questionnaires is that every time they make their visit, they'll sign off on eligibility questionnaire, which they will sign during their visit of doing their semen deposit, as well as when they do their labs, they'll do an extended version, which is their medical history form. Once everything has been approved with the initial approval from the medical committee, they'll do a physical examination. So the physical examination will be done by a medical provider, and they will do what we have as our own physical exam form with our company, and then they'll abide by what the physical that they have to follow. Infectious disease testing, we do follow our FDA regulations plus some, and I'll go over that on our next slide. Genetic disease screening, we're going to also discuss that as well, because that will be done for all of our donors. Verification of transcripts. So once the donor is approved, we'll verify their education by obtaining their transcripts. Whether if they're undergrad or even if they have their master's, we'll still acquire that from them. Okay. So as I mentioned, our infectious disease testing, we follow the FDA regulations with serological testing and NAT testing, plus additional bonus testing. Fairfax is a cryobank, which is FDA approved. So you mainly want to use an FDA approved cryobank, which is our major cryobanks. So serological testing is basically using for either blood or serum. So we follow the serological testing of HIV 1 and 2, hepatitis B, hepatitis C, CMV, syphilis, and HTLV 1 and 2. We also do the nucleic acid testing, which is our NAT testing, and we do the HIV 1 and 2, HTLV 1 and 2, HCV, chlamydia, gonorrhea. We have the CMV. We actually not just do serological testing, we actually do semen sample and do the PCR testing and extract DNA to make sure that there's no CMV inside of the semen. Do herpes simplex virus 1 and 2, and then also HPV is done by Fairfax, and as far as I know, that we're the only cryobank that actually does the HPV testing also within the semen, and do a PCR testing within the semen, and they will do the strains 16 and 18. And I'm sure if you have additional questions, we can have Kate explain further on that. So additional testing as well. We're able to do additional testing. You would just have to contact our client services rep and they can forward you to the appropriate site in case if there's any additional testing you need for the donors. Okay, genetic testing. So genetic testing has definitely evolved throughout the years. The technology has improved tremendously. So starting from chromosome analysis, all of our donors perform the chromosome analysis, which is the karyotype. We do cystic fibrosis, hemoglobin electrophoresis, which will test for the beta thalassemia and the alpha thalassemia. We do the spinal muscular atrophy. And then the specific diseases are listed on the genetic testing summaries. So you can locate the genetic testing summaries on the donor search while pulling up the profile, and then you'll be able to click onto the right-hand side where it says genetic testing summary. And then if the donor has any type of carriers or diseases, then you can actually see what the donor has done as far as also the expanded lab panel. So it's starting on January 1st, 2018, all donors were tested for over 180 recessive diseases. And then starting this year, our new donors have tested over 502 recessive genes and diseases. If you want additional information on genetic screening, I highly recommend watching a webinar from our genetic counselor, Suzanne Seitz. She goes over the whole screening process, all the difficult questions, and since it's such a elaborate webinar, you'll actually get a way better understanding from it. So I really do highly recommend watching the webinar on genetic screening. Choosing a donor. So since we've already gone through the background of what our donor testing and screenings are, simply, choosing a donor is what the fun part is. So most of the time we just tell people, go and sit down, write down the characteristics that you think is very important to you and what you value. So just like physical features, ethnic origins, personality, education, donor category ID, and non-ID. So we do have all of those types that we can go onto the donor search, and you can actually do an advanced search or where you can pick which characteristics are important to you, and then it'll pop up what's the available donors, and then you can look at their profiles from there. All right, so resources to help you choose. So once I said that if you go onto the profile, you'll be able to see all of these profiles that you can actually choose from. And then so starting with like childhood photo, all the donors will, probably about 99% of the donors will have a childhood photo. The summary profile actually is a brief overview of the physical, medical history, family medical, which I mentioned the 3 to 4 generations, religion, and updates. Staff impressions is basically staff impressions from our laboratory who have had the one-on-one relationship with these donors. And so they'll provide their input on what they feel like their impression is for the donor. Donor essays, we provide the donors a few questions and they'll simply just answer it in their honest opinion. Audio clips from the donor and staff. So this is a really neat tool that, we have a brief audio clip from the donor so you can actually hear their voice and that they will, provide their answers to specific questions that we provide them as well. And then the staff will also do an audio as well with their own voice, and then you can hear what their input is and their impression of the donor. Medical profile. Medical profile consists of their personal behavior, the sexual history, the donor history, if they have tattoos or any piercings, and as well as their family history. So as for the genetic testing summary, this is where I mentioned earlier where you can go onto the profile and see if the donor has any type of genetic carriers, diseases, and it'll pop up into a brief summary for you. Face Match is also a free tool that you can use that it compares two facial images of features like the structure of the donor and be compared to the actual photo that you download. So it could be like your partner, it could be a celebrity, it could be anybody who you download a photo of. And you want to have it like face forward so it'll identify the facial structures better. It'll pop up as either high, medium, or low. Don't be alarmed if it's not high. Many people have different facial structures, so a majority of the time will be like medium or low. Also, the face match, it doesn't recognize color. So what you could do is choose the color onto the website, like say for your eyes or hair color. So if you prefer someone with blue eyes, then it'll give you the actual search to match that as well. All right, and then so with the personal profile and thereon is items that you can actually purchase. The ones I mentioned before are the ones that are free. The personal profile is actually the extensive info, including the family history. So instead of a brief overview, it's a very lengthy page, multiple pages of what their personal profile and their family history is. Silhouette is basically a blacked out version of the side profile. And then adult photos. So I want to say our percentage has actually grown in a good amount of percentage of adult photos because now adult photos, I want to say recently within a few years that we require this from the donors. Not lifetime photos are required, but a lot of our donors do opt into it. And then our full audio interview is basically the longer version of what the audio clips, the brief audio clips. So it could be approximately 15-20 minutes long. Personality type, our donors will do a personality test and you can see if maybe if they're introvert, extrovert, etc. All right, so the 90-day unlimited access plans. This is where all of the items that I just mentioned, and you can actually see what preference you like. As far as if you want to just do free items, everything here is checked for you. So you can do summary profile, medical profile, staff impression, donor essay, audio clip from the donor and staff, and childhood photo. You have the basic access, which will also include the personal profile and silhouette. The full access will include full audio, lifetime photos, adult photos, and personality types. What I highly recommend is taking advantage of the full access with Club Fairfax. Not only does it include all of the items, it also includes 2 free shipping fees. And shipping is not cheap. So if you can take advantage of that, it's approximately, I want to say it was like $320-ish. Doreen at the end can answer any shipping questions, but that right there alone. Oh.
Sorry, $330.
Thank you. That alone will pay off what already is, for the full package, along with being able to see everything within 90 days unlimited access. So also, if you buy 5 vials, you can receive the 6th one free over with the 12-month period. And then also you get to see the new donors before they come out over the next 12 months as well. So I really highly recommend. This is a great value, and like I said, you get to see it over 90 days, unlimited access, and as well as the shipping is a big asset to getting this package. All right, so we go to the vial preparation type. So we do have 3 different vial preparations. for sale. We have the IUI, which is the intrauterine insemination, ICI, intracervical insemination, and ART, assisted reproductive procedure. The IUI is a pre-washed vial, which they pre-wash the specimen prior to freezing and freezing the vial. This has approximately about 10 or more motile sperm. The ICI is not washed, so this is a straight freeze, and so the seminal fluid has not been removed from the ICI prior to freezing the specimen. ICI is a standard vial, which also has 10 plus motile sperm. ART vials were basically created to help with IVF procedures. And so it's a lot, less sperm, but at least with 6 motile sperm or higher. And this was to be used for IVF, like I mentioned, that, it's a cost-effective way. So you're not spending so much money on the IUI or the ICI. The ART, the benefit is so if there are no IUI or ICI vials, you can combine 2 ART ICI or ART IUI vials for an insemination procedure. And then Kate will go into the different procedures and she can explain it better on that too. So IVF is the in vitro fertilization and ICSI is the intracytoplasmic sperm insemination. And so briefly, like I mentioned, so in-office inseminations, you can use an IUI pre-wash vial, which the seminal fluid has been removed prior to the freezing. The ICI, as long as your clinic has the capability of washing sperm, they can use the ICI vial prep. And then, so the 2 ARTs that I mentioned with the ART IUI and the ART ICI, combining 2 vials for 1 insemination. The home insemination, you can use any of the vials, but if you can get the ICI vial, that's the preferred method of using for home insemination, as well as the other vials. Assisted reproductive technology procedure, the IVF and ICSI, you can use all of the different vial types, but if you're able to use an ART, then you could just obviously look into the website to see what vial types are available, or you can also call in to client services and they're great in helping you and trying to assist. What we do recommend is that you ask your medical professional to make sure what they prefer first. And sometimes they might have a certain preference of what vial type they might want to use, and then you can take it from there. All right, so if you're ready to purchase, all you have to do is complete the terms of use online. If you want to order or contact client services, just make sure you have your donor number, preparation type, number of vials, whether you ship into your clinic and provide them the information, or if you want to store vials at Fairfax. I highly recommend you contact client services if you are trying to ship at home. Some states are different, so it depends on what's applicable. So just call client services and they'd be able to help you. There's additional forms as well. And then also if you want to just call for vial availability or limited vials. So client services, again, is a tremendous help. They will go through the step-by-step if you need to, or answer any questions that you need. All right, so that's it for me. So we're going to go ahead with Kate Wisdom, who is our women's nurse practitioner, and she's going to go over the whole insemination process with you.
Thank you, Christina.
You're welcome. Thanks.
That was awesome. I love talking about donor sperm. Fairfax has some really elite donors, and I think you'll all be impressed when you check out the website. So my name is Kate Wisda. I'm a women's health nurse practitioner. And to start off, I'd like to say happy Pride and happy Juneteenth. Very happy to be here. We're going to start off with some insemination options. We'll talk about preconception health, home insemination, and intrauterine insemination, which we have here as in-office insemination. Next slide.
Sorry, I'm trying to move it to the next section. So there you go. There you go. Just want to make sure.
No
All right, there you go.
So the question, do I need to work with a medical provider? The short answer is yes. And I'm going to go on and on about this for a few slides. So Fairfax Cryobank recommends that everyone beginning their family building journey speak with a medical professional to ensure their overall health and wellness. Now you can see your primary care provider or your gynecologist. If you are hypothyroid, you want to see your endocrinologist too. If you have diabetes and you have an endocrinologist, you also want to see them. If you're on psychiatric meds and you want to become pregnant and you want to know if your meds are okay for pregnancy, speak to your psychiatrist. The patients always ask me, should I see my primary care or my GYN? Which one do I pick? And I usually tell patients, just pick the one that you're most comfortable with. Pick the one that you have the best relationship with. It's best to have a provider that knows you well, that you can be open and honest with. But since we're doing an LGBTQ plus webinar right now, I will say I think it is important to tell your provider that you're planning on doing in-home insemination. And I think it's important to let them know that you're planning on taking fertility meds or that you're planning on doing intrauterine insemination. But when it comes down to it, this is a really basic exam that we're asking everyone to get. It's just kind of like an annual physical, but we call it a preconception exam or pre-pregnancy exam. So technically, guys, you don't need to tell your provider all the details. So our clinic in Pasadena would have patients from rural areas that would drive to come and see us, and they didn't have providers that they could talk to in the way that ideally we'd want to talk to, right? To say, I'm queer and I'm trying to conceive and I plan on doing in-home inseminations. Not everybody can do that. And technically, it's okay. What you want to tell your provider is that you're trying to conceive. It should be the same exam for everyone who's trying to conceive. There may be some differences, and we're going to go into that, but it shouldn't be related to being queer and to doing an in-home insemination versus having heterosex, okay? Your provider will assess your health and lifestyle, make recommendations to prime your body for pregnancy. They may recommend fertility testing depending on your age and medical history. We'll go into that a little bit. And it's best to ensure your readiness for pregnancy before investing in the home insemination process. So to be totally honest, we know that this is a costly procedure. We know that there are a lot of patients who are taking their life savings and investing in their family and investing in their happiness, their quality of life by conceiving, which is a wonderful, beautiful thing. We don't want you to start out this process without knowing that you're ready for pregnancy. We want to minimize risks of miscarriage or pregnancy difficulties. We want you to do this in the healthiest way possible, and we don't want you to waste money, right? The whole goal here is to get you pregnant and to build families. So as we get into a new age and we have this new Gen Z generation, we're finding that more and more couples identify as queer, and more couples with modest incomes and modest savings are interested in conceiving and starting families. So it's about doing these first steps, meeting with your medical provider, and just kind of making it happen, not wasting time, not wasting money. Okay, so next slide. All right, here is our preconception exam checklist. So like we said, a preconception exam is a pre-pregnancy exam. All you gotta do is call your doctor and say, I need a physical, I'm trying to conceive, I'm trying to get pregnant, wanna make a baby, whatever, and they will approach your exam accordingly. So what they'll do is they'll take some labs. We've also got some screenings and checks. We'll review that in a minute. We'd like you to go in with a full list of your medications and your vitamins and your supplements, all the extra things that you're doing, all the stuff you put in your smoothie. We want to know what supplements you're taking, powders, magic potions, all of that. And then we'd also like to know about any past pregnancies so we can ensure the healthiest pregnancy possible. Next slide. So preconception exam labs. So we're going to do some really basic labs: HIV, chlamydia, gonorrhea, syphilis, Hep B, Hep C. We want to know that there is no infectious disease that we can prevent. They will do this. You should do this before you try to conceive. They'll do this after you're pregnant. They'll do this right before you deliver. These tests are they're so easy to prevent disability by finding out if you are positive for any of these, that we just do it, and then we do it again, and then we do it again, just to be extra sure and to protect the baby and to protect you. It's good to know your blood type. We want to know a little less, we want to know the letter A, B, O, but we want to know whether it's positive or negative. That's important. It comes into play when we have later miscarriages. It's kind of part of the fertility journey that there's that risk, so we want to know if you're positive or negative. And then there are fertility labs. So I would say that if you're under 35, you don't necessarily need to do fertility labs. Thyroid is something that everyone should do. It can affect your basic level of fertility if your thyroid is off, if it's not within a normal range. So thyroid, everyone should do. Anti-Müllerian hormone is your egg reserve. Under the age of 30, 35, you don't really need to find out your AMH. You don't really need to spend that extra money. Sometimes it's not covered by insurance, but it will, if you're over the age of 35, it'll let you know how many eggs are there. We know that if we have a low number of eggs, then we start to worry about quality. We start to worry about quality, then we're concerned about what procedure we should start with, whether you should start with ICI or go straight to IVF. So if you're over the age of 35 and you're curious to know your fertility, AMH is usually the standard test that we're going to do. They'll also draw your hormones and make sure that everything is within a normal range. But like I said, under the age of 30, 35, you don't really need to check out your fertility other than thyroid. Immunity and vaccines, rubella and varicella. So I just want to explain really quickly. Rubella and varicella is a recommendation because if you were to get rubella or varicella, you could have a rash, maybe some flu-like symptoms, but there's a very high risk of disability in the baby. So again, one of those things that's so easy to prevent. All you need is a shot. Rubella is something that if you've been vaccinated as a baby, you probably don't need a vaccination later in life. Varicella, if you have been vaccinated for varicella, if you've had chickenpox, varicella is chickenpox. Even if you've had chickenpox, most people need a booster at some point in their life. So it's so easy to prevent. Just go in, you get your booster, you wait a month, and then you try to conceive. Influenza vaccine, myriad of reasons to get the flu vaccine, the most important being to prevent fever. We know that fever, prolonged fever, can have a negative effect on the baby. And then, of course, a COVID vaccine, which we all know the reasons for that. Next slide. Okay, preconception exam, screenings and checks. So if you're due for a PAP, get a PAP. Once you get pregnant, they may do another PAP on you. After you deliver, they'll probably do another PAP on you just to make sure that your cervix is okay. The cervix is the muscle between the vaginal canal and the uterus. You can see it here. It's actually written. It's right in the middle there. And that, in a sense, sort of keeps the baby in. And it develops when you're pregnant. It gets potentially double the size to sort of keep that pregnancy in. It's the stopper. Mammogram, it's good to know if you're of the age that you need to get a mammogram. It's good to have that screening. We know that pregnancies can exacerbate breast cancer, so we want to make sure that everything is okay. If you have any lumps or bumps, get those checked out first. Check pre-existing conditions. So fibroids, if you've ever been told that you had a fibroid, it's a good idea to check to see if it's grown. Usually they'll do a sonogram. They want to make sure that it hasn't grown. They'll check the location to make sure that it's not within the uterine cavity. So it's not in the place where the baby would grow, because that can cause growth restriction. So just check on that fibroid, make sure it's okay where it is and that the size is okay. And then your OB, when you meet with your OB, you'll let them know that you have a fibroid, and they'll watch it through your pregnancy to make sure that everything is safe. If you have a pre-existing condition such as diabetes, hypo or hyperthyroid, hypertension, obesity, we want to make sure that you are stable. So making sure that your blood pressure is in control, making sure that your sugars are good. We want to have you at, I believe it's a 7 or below before you try to conceive. So your doctor will help you make a game plan. It's not about discouraging you from getting pregnant, but about making that game plan so that you can be the healthiest you can be during your pregnancy, so that your fertility is the best it can be, so that you can get pregnant in the first place, and so that you can protect the fetus, the baby, right? Hysterosalpingogram. So in certain situations, we want to check the tubes to make sure that they're patent. So if the eggs are in the ovaries and they come down through the tubes, we want to make sure that those tubes are open so that the sperm can swim up and the egg can come down and implant in the side of the endometrium inside the uterus. Talk to your doctor about whether or not you need an HSG. The average person doesn't necessarily have to have an HSG. They'll ask you about your history and determine if it's important for you. Genetic disease. So just like our donors, it's a good idea to talk to your doctor about possibly being a carrier for genetic disease. If you know that you've got a cousin with a rare kidney disorder and you don't know the name of it, call your auntie, find out the name of the genetic disorder, and then tell your doctor. Your doctor will help you determine if there's a risk. If you know that, say, your parent is a carrier for sickle cell, you want to know if that passed on to you, and then you can choose your donor accordingly. So if you know that you're positive for sickle cell, it doesn't mean that you can't have a baby or you can't get pregnant, and it doesn't mean that your baby's going to have sickle cell. It just means that you have one of those genes. So you want to make sure that the donor doesn't have that so that you can have a baby without sickle cell. It's about, again, planning ahead and managing risk. Next slide. Preconception exam, medications and vitamins. So make a list, bring it with you. I know that a lot of us, like myself included, take a lot of supplements, a lot of vitamins. If you're taking a prenatal, we want to know. We want to know how long you've been taking it. We want to know what type. Are you taking a good prenatal with DHA in it? We want to know if you're taking any fertility boosting vitamins, such as Vitex or chasteberry, maca root. We want to know if you're taking anything to minimize testosterone, like DIM. Are you taking biotin? Biotin can actually cause false elevations in thyroid. It doesn't increase your thyroid function, but it will show up falsely on your lab so that we all think that you're hyperthyroid, but you're not. Sorry, hypothyroid, but you're not. So it's important to let your doc know everything that you're taking. If you're putting spirulina in your smoothie in the morning, let the doc know about that. All medications, we want to know about every single medication you're taking, including the Zyrtec or the Claritin you take at night, the Flonase that you use, all of that stuff. Some medications are harmful to the fetus, and it doesn't mean that you have to go, say, off your psychiatric meds. It just means that we're going to find a better med for you or a safer med for you while you're trying to conceive and while you're pregnant. Okay, next slide. Preconception exam, past pregnancies. So some pregnancy problems have a higher risk of repeating in succeeding pregnancies. Typically, the ones that we think of the most are high blood pressure. High blood pressure, if you had it in pregnancy, you may have it again in this next pregnancy. Same thing with gestational diabetes. So if you've had gestational diabetes and it was in your first pregnancy, and now you're going on to your second pregnancy, we're going to start testing your sugars super early. We're going to check before you conceive. They're going to continually monitor your sugars while you're pregnant. And in fact, I would say this is when you're going to be super, super careful with your sugars in general, even if you're not diabetic, but you have a history of gestational diabetes, we want to be super, super careful with that. And again, minimize risk to yourself and to the baby. Reduce risk with proper care before, during, and after your pregnancy. Ask how, develop a treatment plan with your provider. Okay, next slide. Okay, so on to our next topic is home insemination right for you. So the other words that we use for home insemination, intracervical insemination, or ICI. So the answer, if it's right for you, is yes. If you are free of fertility issues. So for example, ICI is not the best for patients who are advanced maternal age, which is over the age of 35. And it may not be the best for patients who have polycystic ovarian syndrome, which can cause some fertility issues that just need medication to boost them up. We also want to know that you're comfortable with the idea of performing the procedure in your home. It's not a sterile procedure. You don't need special equipment, but and we'll talk about that in a minute, but whether or not you're comfortable doing it in your own home. You've discussed family building with a medical provider. As we talked about, you have your preconception exam. If it is acceptable under the laws of your state, and client services can answer those questions for you, just give them a call and say, hey, I'm in California. Is this legal in my state? I don't want to get in any trouble. Why try at home? Often couples are told to try at home for several months when they want to start their family. Home insemination allows individuals and couples without a sperm providing partner to try at home before moving to in-office procedures. In-office procedures would be your more medical procedures, right? That do need sterile equipment, that do need a super clean environment. Next slide. All right, getting started. So this is one of the most important pieces of trying to conceive with donor sperm. The person being inseminated must track their menstrual cycle and ovulation. So if you've got a tracker on your phone, that's great. If you don't have one, please, please, please get a tracker on your phone, a period tracker. A company like Flow can track your periods, and they're free. You don't have to pay the extra money. You don't have to pay the extra $2.99 unless you want to. And you'll start tracking your periods, because we want to determine when you're going to ovulate. Patients typically ovulate in the middle of their cycle, a cycle being from one period to the next. Cycle typically lasts 28-30 days. Some patients are 21 days, some patients are 35 days. It just depends on the person. So there's commercially available ovulation kits to help you determine your fertility window. Now this is kind of a small picture, but if you look in the middle, those purple bars, they show on this patient that her positive fertility days are 11 and 12. Next slide. Fertility window. So you're technically only fertile for a 12 to 24-hour window once a cycle. So once a month, you're fertile, and it's only for 12 to 24 hours. So when you're doing home insemination, we want to get this right. We want to be super, super exact. If you're off by 2 hours, no biggie. But if you're off by 2 days, huge biggie. You're not going to get pregnant, right? So most patients are fertile between the days of, say, 11 to 17 of their menstrual cycle. If your menstrual cycle is longer, sorry, not your menstrual cycle, your menstrual cycle. So if your cycle is 31 to 32 days, that's a little bit of a longer cycle, then we expect your ovulation day to be somewhere around 15, 16. It could even be cycle day 18, especially if you have a longer cycle. If you have a shorter cycle and your cycles maybe 25 days, 27 days, even 21 days, you might see ovulation day come earlier. So cycle day 9, 10, 11, 12. And that's okay. If you keep testing and you're practicing, which I would highly recommend you take at least 2 cycles to practice your ovulation predictor kit testing. If you're testing and testing and you keep getting cycle day 8, cycle day 9, then that's your true ovulation day. If your cycle goes for 35 days and you're getting cycle day 8, cycle day 9, that's very early, and you might want to talk to a provider about why those ovulation predictor kit tests aren't working for you. So to summarize, if you have a long cycle, usually your ovulation date will be cycle day 14 or after. If you have a short cycle, usually you'll see an earlier ovulation date, like cycle day 9, cycle day 11, 12, before cycle day 14. This is unique to everyone. Best to monitor your cycle for several months to establish your regularity. Nobody ever listens to me, but if you test for a couple months ahead of time, you'll get a really good understanding of your ovulation date so that you can be precise, because you've only got that 12, 24-hour window. And if you can get that window right, that's how you get pregnant. Your medical provider can answer questions about this. So yeah, so if you have any more questions, you can ask me at the end of the webinar, or you can talk to your doctor about it. Next slide. Okay, what do I need to do a home insemination? So a comfortable space where you feel safe, a needleless syringe, a sperm sample, instructions, some insulated gloves, and eye protection. We're going to go through all this. Next slide. Okay, prepare the space and yourself. So it's important to have a comfortable, safe space. Ideally, you'll be reclining on your back with your pelvis tilted for up to 2 hours. So if your most comfortable, safe space is your bed, your sofa, if it's the floor, it doesn't matter. As long as you're comfortable and you feel good, and you can stay there for about 2 hours, it's fine. If you have some really great soothing music you like to listen to, if you normally, when you meditate, you listen to a certain kind of music and you like candles, then that's what you're going to do for this insemination. You will place yourself in a positive frame of mind, focus on relaxation, meditate if that appeals to you, and breathe mindfully. So I will say that ICI is an extremely unique experience. When you're doing at-home insemination, ICI, there's really nothing else that compares to it. So a lot of individuals or couples take this time to make it very special and make it very beautiful. So I've heard of patients putting the crystals on their body while they lay there for 2 hours. We've had patients where one patient, her wife, read their favorite children's book to her while they were waiting that 2 hours. You can make it really special, and there's no reason not to. It's a really beautiful process, and there's nothing else that compares. So next slide. All right. So this is intracervical insemination. Now we're going to go over the equipment. Gather everything you need and place on a solid surface. So this is a nursing trick. Think ahead all the steps in your mind. Think of all the things you're going to need ahead of time. It's going to take you 5 minutes to prepare everything. So take that 5 minutes, think ahead. What if I need paper towels, or what if I need my telephone, or I don't know, whatever it is that you need, you're going to put it all in front of you. So when you forget something, you only have to get up once instead of 6 times, because you're excited and it's a new experience. So gather everything you need, put it on a solid surface, and keep it close to you. So Christina is going to show us how to open the needleless syringe. So it comes in a wrapper, it's sterile. So you'll open it up and you'll leave it in the wrapper so that the tip stays in the wrapper and it stays clean. The sperm vial thawed per instructions from the cryobank. So what you're going to do is, you can see this picture down here on the right. You'll remove the tank lid. When we tell you to have protective eyewear, it's mainly for this purpose. So when you open up the lid, there'll be a small puff of vapor. Just be prepared for that and lean back. It's not super dramatic, but it is a puff of vapor. We don't want you getting that in your eyes. You will be wearing gloves, probably oven mitts. Wearing gloves, carefully remove the cane holding the vial. Christina has the cane there, and there's a vial in it. That's exactly what you're going to see when you open up the tank. It's this little tin, it's very light, and then there's a little, it's got room for like 4 vials, but you only get 1 at a time for most people. So you'll wearing gloves, you'll carefully remove the cane holding the vial, remove the vial from the cane, and verify the donor number. So see how she popped it right off? Super easy to take off. On the side, there'll be a number. It'll say 1, 2, 3, 4, and you can check your paperwork that comes in the tank box, and it'll say 1, 2, 3, 4, and you check the vial, it says 1, 2, 3, 4, and there'll probably be like a ton of information in there about infectious disease testing, genetic testing, and so you know that that's your donor. Wrap the vial in a cloth or paper towel to dry off any condensation, and then this is the best part, you leave it at room temperature for 15 to 20 minutes to allow it to thaw. So you don't have to put it in a bath, you don't have to put it in your armpit, you don't have to put it anywhere special, you just leave it on the counter and it will thaw. And I would say after maybe 10 minutes, go check it and you can invert it. Christina will show you how, and you'll see if it's still frozen. If it's not, you give it another 5 minutes. It's okay if it's a little cool, it's okay if it's a little room temp, doesn't matter. We just don't want it to thaw too quickly, or I guess too slowly wouldn't matter. So we just don't want it to thaw too quickly. All right, next slide. Okay. ICI continued. The person doing the insemination, it's either yourself or your partner, will wash their hands thoroughly. The person being inseminated will lay on their back with their hips elevated. If you want to, you can have your knees bent. That's usually a more comfortable position. Use a cushion to support the back. That's a lie. You're going to put it under your butt. You're going to put it under your butt and under your lower back because we want your pelvis tilted. We're working against gravity. So that sperm can actually fall out if you stand up. So we want you in that tilted position to just fight gravity and keep the sperm in. You're going to pick up and gently mix the sperm vial. Allow the volume to settle to the bottom. So again, you're not going to shake it. You're not going to stick something in there and whip it up. You're just going to invert it. Christina's very good at inverting. Open the syringe and pull the plunger up to break the seal and push it back to its original position. So this is another nursing trick. There's this thing that happens with syringes, needleless syringes, where you have to kind of mess with the plunger to get it to move smoothly. If you don't, it gets stuck for the first time you push it down or pull it up. So just kind of place it a couple times, just kind of sit there, na 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 na, and then it'll move smoothly like Christina's showing, and then you'll be good to go. So next slide. All right. You and your partner will carefully open the sperm vial by unscrewing the cap. There you go. That's simple. Slowly and carefully draw the sample up into the needleless syringe. So you've already played with that plunger. It's not going to get stuck. There's no air that's going to get stuck in it. You've got it all nice and smooth. Place the syringe into that vial and then pull it up. If there's a little bit of air in there, absolutely fine. You can put air into the vagina. It's not a problem. If you want to, well, we'll move on to the next one. Place the syringe into the vagina as far as it will go, with the tip close to but not touching the cervix. So you can see this purple arrow shows the back of the vagina, and it's actually pointing to the surface of the cervix. So you're going to put this syringe in, and you'll hit something. You'll hit the back of the vagina, which is the cervix. And once you hit it, pull back just a little, just to give room for that sperm to come out, right? So put it in, pull it back a little, and then press the plunger down. You can do it really slowly. You can do it really quickly. It's totally fine. Gently expel the sperm sample onto the cervix. Remove the syringe and relax. The syringe will be long enough. You do not need a rounded syringe. If you look at the syringe and there's a little bit of sperm still left in there, pull it back, put some air into it, and then push it in again. Air can go into the vagina. It's absolutely fine. You probably won't even notice it. Remain lying on your back comfortably for at least 30 minutes, but up to 2 hours. Do the 2 hours, don't do 30 minutes. And there's this genius thing where you lay on your back, and every 20 minutes, you switch over. So as you're switching over, if you look at that purple arrow again, the sperm is going to wash over the cervix. The cervix has a hole in it. The hole is called the os, and the sperm swims through the cervix, through the os, into the uterus. And so every time you flip, that sperm washes over that hole And so it reintroduces the sperm over and over and over again to the hole in the cervix, so that it kind of encourages it, like, hey, you want to go this time? You want to go next time? You want to go this time? And to get the sperm up into the uterus where your egg will be. Next slide. Post ICI. So this is not FDA approved, but I think it's a great idea. Some individuals will use a soft cup placed on the cervix after the sperm is expelled. So at the very top, you're looking at a soft cup. You can just Google soft cup, it'll pop up. They're relatively affordable. And at the bottom, you're looking at, I think it's a picture of like a diaphragm or a cervical cap, exact same idea. Same as a menstrual cup. Some people will use menstrual cups as well. Again, not approved. No one anywhere has said that they've done studies and this is the way to do it, but a lot of people do it this way. You can, after maybe the 2 hours, if you want, you can put the cup in, and it encourages that sperm to stay up by the cervix. We talked about introducing the sperm to the cervix. So if you have a cap over it with the sperm inside of it, it just stays at that cervix and encourages the sperm to go in, because the sperm's going to swim any direction. They're going to bump heads, they're going to swim out of the vagina, they're going to swim all over the place. Some of them are just swimming in circles. They're not little geniuses, they're just little sperm. And so if you can help them get into there, it can be pretty beneficial. Some people do it right away. Some people like to put the donor sperm directly in there and then put it in. It's entirely up to you. Remaining reclined allows the sperm to swim through the cervix and into the uterus up to the egg. Some individuals choose to do multiple inseminations during the fertile window, that's your 12 to 24 hours, in one cycle. Speak to your medical provider about this option if you have questions. Okay, next slide. Cost of ICI, or in-home insemination. Costs include the cost of the donor sperm, which is typically $1,100, I think, $1,200. Shipping and handling, unless you do that cryobank. Christina, what is it called? The cryobank membership?
Club Fairfax?
Yeah.
So Fairfax, that's what it's called. Unless you do that, then you get free shipping and handling. Fairfax Cryobank will provide written instructions for thawing the sperm sample and for the ICI, along with a needleless syringe. So there's your paperwork, you'll get your syringe, and there'll be instructions, but we already told you how to do it, so you know how to do it. And then thawing the sperm, of course, is just leaving it on the counter, which is so easy. Next slide. Okay, success rates. If you have no fertility issues or concerns, it can be up to a 10% success rate per cycle. The average person, it's typically closer to 5%, but it really depends on age, it depends on your health. It can take several insemination attempts to achieve pregnancy. So yes, most people don't get pregnant on the first time. It will take multiple times. If you are not pregnant after several home attempts, it is best to speak with your medical provider about having a fertility assessment. And we talked about that earlier. If you're doing 4, 5, 6 times and you're not pregnant, it may be time to talk to a medical provider. If you want to go up to 10 times, that's fine, but at least know what's going on in your body and maybe get some answers as to why it's not working. Okay, next slide. Intrauterine insemination. So this is our next procedure. Guys, do we have time to talk about IUI? We're good?
We're good, if you're good.
Okay. So why try IUI? Not comfortable with the ICI procedure. If you just aren't comfortable with it, you don't want to do it in your home or it makes you nervous, that's fine. There are higher success rates for IUI. IUI is good if someone has some reduced fertility, not fertility issues, but maybe something like polycystic ovarian syndrome, where there can be some difficulty getting pregnant. If you're over the age of 34, so if you're 35 and above, that would be advanced maternal age. IUI is a good place to start over ICI. And if you're having issues with ovulation predictor kits, The honest truth is those ovulation predictor kits don't work for everyone. There's other ways that we can see if you're ovulating. It usually involves sonograms. So if you can't get the OPKs to work, it's okay. It doesn't mean that you're not fertile. It doesn't mean that you can't get pregnant. It means you need assistance. It will cost a little more money. It will be more timely, but it's okay. You can still get pregnant. Medical oversight. Yes, so you're having a medical provider watch you through this whole process. You're having a fertility specialist check your labs. They're going to do sonograms if you need them, and they'll be able to keep an eye on you. So if you have a history of early miscarriage, polycystic ovarian syndrome, hypothyroid, low fertility, difficult predicting ovulation, difficulty with the OPKs, or if you have super irregular cycles. What I mean by irregular cycles is 1 month you have a 21-day cycle, and then the next month you have a 36-day cycle. That would be irregular. If you have a 30-day cycle and then the next month you have a 32-day cycle, I don't care about that. That's fine. That's pretty normal to be off by a day or two. But if you're off by 5, 6, 7 days, that's when we want you to consider doing something like IUI. It's all about getting you pregnant. Additionally, ultrasounds to watch follicle growth, medications to ensure ovulation, potentially prevent early pregnancy loss. An IUI, oh, I'm sorry, I didn't explain the procedure. An IUI will bypass the vaginal canal. So you're depositing the sperm. So you can see this metal speculum that's inside the vaginal canal. That is the length of the vaginal canal. When you're doing an ICI, it just deposits right into that vaginal canal. If you're doing an IUI, it goes through the cervix into the uterus. So it bypasses the vaginal canal, bypasses the cervix, that little muscle we talked about where you constantly keep trying to reintroduce the sperm to the hole to swim up to the uterus. It bypasses that, drops it directly into the uterus, which makes sense why that would be a higher success rate, right? You don't have to worry about those sperm swimming in circles and going all over the place. It's immediately in the uterus. Next slide. IUI continued. You will need medical clearance. So if you're working with a fertility center, which typically you will to do IUIs, you'll want your primary care, OBGYN, and or your specialist being endocrinologist, psychiatrist, to clear you. Again, it's just about having a conversation, getting that physical, and making sure you're immune to what you're immune to and you're ready to go for pregnancy. IUI, you need the same labs. Fertility assessment and labs if that applies to you. You'll want a normal pap smear, normal thyroid. We talked about thyroid being very important in fertility function. So a normal thyroid function is normal fertility. We want to make sure that you're not anemic and you don't have any vitamin deficiencies. It's going to be very hard to get pregnant if you're severely anemic. Fairfax to ship sperm vials directly to your clinic. The lab will prep the vial for you. Optional, ovulation predictor kits, fertility medications, ultrasounds. When you're doing an IUI, your provider should recommend what they think is best for you. Some patients like to start with ovulation predictor kits and then advance to ultrasounds if that's not working. Next slide. IUI process. So you will have a speculum, which is this mean device all the way on the left. That's what we use when we do a pap smear. It goes in the vaginal canal and then just kind of opens it. The vaginal walls are pretty close to each other and sometimes they touch. So when you put the speculum in, you can open it up and we can see that cervix at the end, the little muscle with the hole in it that leads to the uterus. And then you'll have the catheter, which is to the right of the speculum. It is a needleless syringe and on the end is a straw, a literal straw. Super, super flexible. You can, it's like floppy, and that goes through the hole in the cervix. The whole procedure can take 5 to 15 minutes. I've had IUIs that take a couple minutes, and I've had IUIs that have taken the full 15 minutes. So typically it's a pretty easy procedure. It feels a lot like a pap smear. You'll probably have a little bit of cramping, maybe a small amount of spotting, but that's it. Relax with your pelvis tilted 15 minutes. So after the IUI, you'll just hang out for about 15 minutes. There is kind of like when you get your blood drawn, you can have this vasovagal reaction where you get a little woozy because we went inside the body, and you just relax a little bit. I'd say maybe 1 in 10 patients has that reaction, so we like to use just to lay down. And this is usually kind of a nice moment for individuals and couples where usually they kind of hold each other and kiss and cry and that whole thing. So you can make it what you want, right? Even if it's in a cold medical office. Next slide. IUI cost. So you'll pay for your sperm vial. It would be an IUI vial, ideally. And you can, it's about the same cost as an ICI vial. So we're looking at the $1,100, $1,200. You would buy an ovulation predictor kit for most people. You can get that at a drugstore. You can get them on Amazon. IUI procedure, so you'll pay the provider to actually put the straw through the cervix. That's roughly $500. Optional, so ultrasounds versus OPK, medications and assessments. So that would be dependent on your fertility provider on what extra steps they want or need to do. Next slide. IUI success rates. So we were talking about 5 to 10% success rate for the ICIs. For IUI, it's a 20% success rate. For heterosex, we know that each time you try, it's about a 20% success rate. Same deal with IUI. Here we have the age factor. So you can see that starting around age 30, we see our fertility start to decrease. And around the age of, if you look at 44, 45, we know that your success rate is going to decrease quite a lot, down to about 4%, 3%. When you get in those numbers, I'd say over 40, it's a good idea to start talking about IVF versus ICI or IUI. So yeah, so decreased rates of success with age and comorbidities. Comorbidities being, say, uncontrolled diabetes, something like that. Next slide. Assisted reproductive techniques. So we aren't going to talk about this in detail, but if you're over the age of 40, we usually recommend that you start with IVF, which is in vitro fertilization. They'll do an egg retrieval. They'll pull your eggs out of your body. They'll fertilize the eggs with the donor sperm and then create an embryo, put the embryo back in the body. Reciprocal in vitro fertilization. There's egg retrieval from both partners. They fertilize those eggs and then they put them back in the non-egg, or they put them in the non-egg contributing partner. There's also intracytoplasmic sperm injection, also known as ICSI. Next slide. Questions and answers. So you can use this promo code to save $149 on full unlimited access, valid now through June 30th, 2022. Yay, that's it. So I guess for Q&A.
Thank you, Kate. Thank you, Christina. Yeah, great. So if anyone could just go ahead, and we already have a couple questions trickling in, but if anyone wants to use a question panel to submit any questions, we'll go ahead and we'll do a couple as the time allows. Okay. Is there data or advice on whether or not it's better to inseminate at home versus a clinic?
Yes, there is data. So when you're inseminating at home, you're doing an ICI. So you're depositing the donor sperm into the vaginal canal. When you're doing it in a clinic, you're having a medical provider do a medical procedure which deposits the sperm into the uterus. So it goes past the vaginal canal, past the cervix, directly into the uterus. So it's about a 5 to 10% chance of getting pregnant with ICI, and it's about a 20% chance of getting pregnant with IUI. Of course, depending on age and comorbidities, that skews those rates. So yes, IUI is much more successful, and then IVF is even more successful. The rates for all this stuff is they're all a little fuzzy because it really depends on each person and each person's general health. And there's also a lot to fertility that we just don't know as medical providers. There's also that kind of magic factor that happens. So IVF can be maybe 30% chance of getting pregnant. So just depends on where you want to start or where you need to start.
And then should you lie down for 2 hours after IUI like you do for, the other home insemination?
No. So, okay. So you have, so we talked about the speculum opening up into the vaginal canal. At the end of it is the cervix, and the end of that is the uterus. So when you after an IUI, you go through that muscle that I explained it as like the stopper for pregnancy. So you go through that cervix, deposit the sperm. It's not going to come out through the cervix. If it does, guys, I mean, we could probably swab it and send it to a lab, and I don't know, maybe there's a few sperm in there, but when we're talking about 10 million, there's not a significant amount coming out. When you stand up, it's not going to come out. It just doesn't do that. It's not going to go through that muscle. So you're good. You've got 9.9 million on the uterus side, and then the rest is falling out. Yeah.
And
Good.
then can you use IUI prepared sperm for IVF?
Yeah.
Technically, yes.
Yeah. Technically, yes. But you only need a number of about 6 million for IVF. So I think technically you'd be wasting that extra sperm. But if you love your donor, you don't care about spending more money or wasting that 4 million sperm, then yeah, technically yes. But you also, before you buy it, talk to your IVF provider and make sure that they're happy with that idea. I understand it's worth asking. People ask these kinds of things all the time because when you fall in love with the donor, you start to dream about him, you start to dream about the baby, and that's the magic factor, right? So it's worth asking your provider, making sure it's okay.
Kate, we're getting a couple questions about what specific prenatal and also what kind of herbs and other medicines you might recommend ahead of time. Do you have any recommendations?
Yes. So this is a webinar, and I have a medical license, and it's only in California, so I'm going to protect it. I will tell you the recommendation for prenatals is to start taking them 6 months before you try to conceive. Now, this makes everyone's heart drop. 6 months you want to take prenatals. Most people don't do that. So the minimum that we recommend, if you can't do 6 months, minimum is 3 months taking prenatals. Vitamin D is also technically not recommended by ACOG, but most providers will tell you that vitamin D is very pro-hormone. Most people are deficient in vitamin D. Vitamin D is what we get from the sun. So you can take a little bit of vitamin D with it, maybe 1,000 milligrams. That's usually a pretty good idea. Oh, also, when you take your prenatals, make sure that your prenatal vitamin has something called DHA in it. So just like folate, it's going to prevent brain and spinal cord defects. So it'll minimize that risk of having a baby with a brain or a spine disability. So you want a prenatal vitamin with DHA. Some patients like to take extra iron. I just don't think that's necessary. You're going to have a heck of a time going to the bathroom because there's a lot of iron in your prenatal vitamin, and iron just stops you up. And then patients usually have a lot of stomach upset with it. I think as long as you're getting your prenatal vitamin plus your DHA, vitamin D optional, you're pretty good. There's a lot of information out there about supplements such as chasteberry, also known as Vitex. There's also an acupuncturist may recommend something like maca root. These have a lot of empirical evidence to support them. They're not recommended by ACOG or any of the other governing bodies for obstetrics and gynecology. I will caution you that maca does kind of screw up your period. It has this way of kind of screwing up your period and then normalizing it. So if you start taking maca root and you can't figure out your ovulation date, it's because you're taking maca root. So give it a couple more months, and it may improve your fertility. Again, the studies are not there, but there is that empirical evidence of thousands of years of people taking maca root. Vitex and chasteberry, same idea. If you're planning on taking fertility meds, I will caution you that Vitex, chasteberry, they counteract the fertility meds, and they sort of like cancel them out. So you're actually doing yourself a disservice. If you decide you want to take a supplement, absolutely 100%, please be honest with your provider. Let them know that you're taking that. They need to approach your care knowing that you're taking maca root or chaste tree berry.
Do we need doctor's approval or a note to start the sperm buying process?
No, not at all. No, it's just recommended very strongly by me that you meet with your medical provider and make sure that you're healthy enough to get pregnant. But you don't need like a document that says, Kate said that my physical is fine and I can get pregnant. You don't need that necessarily. What do you guys need? You need the doctor's information of where to send it, that sort of thing. Doreen?
The terms of use letter, you'll need to complete that agreement in order to purchase with us. And if you are trying to do a home insemination, there is a form that may need to be sent to your licensed medical professional. And it's not verifying that you're physically healthy, it's just making sure that you're working with a licensed medical professional who can authorize, can give you medical advice. I'm not medically trained. My client services team is able to assist you with purchasing and selling, or purchasing and shipping donor semen, but we're not going to be able to answer your medical questions. So you are going to want to make sure you're working with someone for that.
We're getting a couple questions about CMV, just wanting to kind of understand what positive and negative means, and also what it means if it says that a donor has CMV positive on their profile. Does it mean that they're just carriers or that they currently carry the virus?
Yeah, so this is a debated issue. What do I want to say about this? So CMV, if a donor has active CMV, meaning that their body is affected by CMV. CMV is something that we didn't learn about until the HIV/AIDS crisis in the 80s. It's something that typically doesn't affect our body. If we do have CMV and we get symptoms, it's going to just feel like a cold or a flu. So most people have been in contact with CMV at some point in their life, usually earlier in their life. I think it's something like 50% or higher, 70% of people have come in contact with CMV. I don't know the numbers, but it's very high. So CMV is something that your body will come in contact with. You'll clear it, no problem. If you are immune compromised, then we see CMV come up and it can be kind of tragic. So if you have a donor with active CMV and you were to use that donor with active CMV, that would be cause for some pretty intense disabilities in the fetus. We're not allowed to sell donor sperm with active CMV. So really what we're talking about when we show CMV is that we've tested them. We're showing you proof that we tested them. If it says there's antibodies, then that's us letting you know that in the past he's had an infection. So he's had CMV and now he has antibodies for it, meaning that he has an army, that he has a memory, so that CMV goes into his body again, he's ready to roll. So again, seeing that there's a CMV positive or negative is just telling you about a past infection and whether or not he has antibodies. And for us, it's proof that we've tested him for CMV, for active CMV. You will not be sold active CMV donor sperm. That is not going to happen.
To add on to that is that if the donor does have active CMV, all vials will be discarded, so that will be automatically, you can't sell anything that with active CMV.
Yeah. We'd lose our license, they'd shut us down, whole thing.
And then how many times can one vial be used for? How many should we buy at a time?
Yeah, so if you're buying a vial, once you thaw that vial for, say, ICI, you can't refreeze it. You can't put it back in. If you're doing IUI, you're going to use the whole vial. It's created in a way that the whole vial is meant to go into the uterus. So it's the right amount, it's the right volume. You wouldn't use 2 for one insemination. You would only use 1. So you wouldn't put anything back in and you wouldn't refreeze anything. I don't know, Doreen or Christina, you want to add to that?
Definitely, I mean, like she said, 1 vial per procedure. If you are able to get the ART vial, you could do 1 ART vial for the IVF or ICSI procedure, and then 1 IUI or 1 ICI ART, depending again if your medical professional has the capability of washing the specimen. That will be done for 1 procedure. And then Doreen can actually explain like of how many vials you can get and what you can store.
Sure. So you're able to purchase however many you need as long as we have the availability. In a lot of cases, I do recommend purchasing more than 1 or more than you think you're going to need. especially if you're thinking about siblings or in the future, multiple inseminations. If this is the donor you found and you love and you may want to make sure that you don't want them to sell out, you know, plenty of clients purchase one at a time per procedure. Other clients may want to purchase 8, 10. We do offer long-term storage and discounts on storage if you prepay for it or if you buy a certain amount. The other benefit is having, if you have vials stored at Fairfax Cryobank, we do have a buyback program so that if they don't ship, if they never leave our facility, you can get 50% of your original purchase price back. If you are, you know, if you bought 10 vials just to be precautious and you only needed 2, or you changed your mind. So we definitely do offer that, but it's a conversation about how many inseminations you want to have, procedures you want to have, what you're looking for as far as your family.
Yeah, and that's a conversation you can have with your fertility provider. You know, asking them roughly how many vials. You can also, there's a lot of patients, like we're saying, because there are so many couples now that identify as queer and so many people are transitioning, that we're seeing a lot of young couples that want to start a family and they have a modest income, modest savings. So you can buy cycle per cycle if you need to. That's also an option. Talk to someone like Doreen and say, hey, is this donor active? How many vials do they have? If that donor has 50 vials, then you can go vial by vial. No one's going to snatch up all 50 by the next 2 cycles, you know? But if you're planning on having multiple kids and you want them all to be from the same donor, then yeah, it kind of makes sense to buy 10 ahead of time.
Exactly.
And then if you like a donor now, how likely will it be that that same donor will still be available in 6 months later?
That's a great question, and to kind of piggyback off what Kate said, it really depends on the donor, and the best way to find out what's going on with that donor is to call our client services team and see if that donor is still active, if they're no longer active, if we're expecting more vials, if we are no longer expecting any more vials, what's going on with the donor. Because if your donor has 20 vials available right now, but they're no longer donating, it might not be available in 6 months. If they have 50 vials now and they're still actively donating, it could be available in 6 months. We just don't know, because it depends on how quickly it sells. And again, some people purchase one at a time, or they purchase 8, 9, 10, 12, 15 vials at a time. So it really, they can go quickly. It really depends. If it was me, if I was purchasing it and I could purchase it, I would purchase it as soon as I know 100% that it's the donor I want.
And to add on to that is that donors actually get tested either 3 months or 6 months, and so for their infectious disease testing. And so that's also if for some reason, you know, he's positive for something as an infectious disease, those vials will not be for sale. So that's why Doreen's explaining it. It just depends on, you know, when the 6-month quarantine as well, because FDA regulations is that our donor vials have to be in quarantine for at least 180 days until it's able to do the infectious disease screening and then also another physical. And just all depends if everything comes out good, then we're able to release more vials.
And then what are you guys doing to add more ethnicities to your donor list? That's something that we currently are working on. We're trying to add more diversity to our donor search. We're trying to add more donors for everyone, but we're really just trying to diversify our recruiting methods to help kind of add to the donor selection. So that's something we are actively working on right now.
Definitely.
Yeah, and if you have any friends that you would like to recommend to us, we're quite a few applications. We would love some referrals too.
Yep.
Definitely referral programs. So.
And we got a question asking, why do donors donate, or do they provide a reason, or what is a common reason?
A lot of our donors are, obviously, a lot of them are in college. And so, I mean, one main reason, you know, finances is a big point, but there's a lot of donors that we actually interview one-on-one with, and our lab staff interacts with them and gains a relationship with them. They, you would be very surprised how interactive they want to be with this whole program, and they want to be actually involved, because now we are evolving like with queer families, and they understand, like, you know, being a part of this is actually just kind of like the new generation, and they really want to be involved, and they're actually very active with it. And pretty surprisingly, like a lot of the donors, I mean, all the labs, I know, speaking, I'm from Pasadena, so I mean, our Pasadena laboratory techs, they have great relationships with our donors, and they, you know, it's really nice to see that the donors actually want to be involved with this and be a part of the new families and new queer families.
Yeah, can I just say real quick, I used to do the physical for the donors in Pasadena, and I would always ask them, just because I'm nosy, you know, why are you donating? Sometimes they come in and they're donating for a friend or a family member. So maybe their sister is in a same-sex couple, and they're donating their sperm so that their sister's wife can get pregnant. There's more good behind donating than bad. It's very rarely about the money. It's kind of neat to hear people talk about how they care about helping out families and creating loving families. It's pretty neat.
Yeah.
And then I guess the flip side of that is, what does it mean to be a non-ID donor? Someone's asking about that category.
So non-ID donors are anonymous donors that are part of the program, but the ID donor versus non-ID is that ID donors, once the offspring, which we call as donor conceived individuals now, once they turn 18, they do have the option to contact Fairfax and to start the process of obtaining the identifying information of the donor. Unfortunately, with the anonymous donors, they do not have that option. So their identifying information will be anonymous, basically. That's just the difference between them two.
And I will just add that the ID donors, if you are a donor conceived individual or a client who has a child or a donor conceived individual with an ID donor, you do have to register them in our ID program before we're able to release any information regarding whether or not, regarding the donor's identifying information.
Right. So when the baby is born, we need to know the date of birth, the full name, just a little bit of information so that when they're 18, they can get that information. And willing to be known is so that donor information can be given out, but the donor chooses whether or not they want to be in the child's life, or they just want to meet them and say hi. So it kind of runs the gamut on their involvement in the person's life, in your child's life. So.
And then I guess, you know, we have another question about donor siblings, and how do you know if a donor has been used a certain number of times, you know, like donor limits and everything like that? How do they find out more information?
So client services is able to release a range of pregnancies or births that have been reported for a specific donor. We do monitor both the geographic location as well as the family units that have been created for that donor. We cap it at 25 family units. That's not 25 births or pregnancies, because a family unit could have more than one child, multiple siblings. But we do monitor that, and at that point, if our donors do reach the 25 family units, they are restricted to only clients who have a reported birth can purchase any additional vials of that donor.
Okay. All right, we have time for one more question. There are a lot out there, some wonderful ones, and I'm sorry we don't have time to, you know, get to everyone today. So please contact client services. Their contact information is info@fairfaxcryobank.com, or call the number on our website. Just contact them if you do have any additional questions we weren't able to get to today. So the last one here, I think this is for Kate. How would you strategize getting the sperm on the correct day? For high fertility, that would be on the 25th, for example. What day would we buy it so it arrives during the perfect window? So I guess Doreen and Kate, thoughts on that?
So we have two kinds of shipping, as mentioned. We have overnight shipping or 2 business day shipping. Once you know when you need to have it arrive, you can determine which shipping option is best for you for that. And as far as the cryobank, we only ship Monday through Friday and have it arrive Monday through Friday. So it takes a little bit of planning for that. Sometimes clinics do want that to arrive a little bit earlier.
So yeah, trying to get the vial to you on time, it can be a little stressful, but it's a little stressful for everyone. So we know how to work with you on that. We know that you need to get that vial shipped overnight, and we do overnight shipping. I will also say that the tanks can last for, is it 7 to 14 days?
Yep, 14
Yeah.
days with a $50 upgrade if you need to. And I do recommend that if you're unsure about your cycle and you want to give yourself wiggle room on either side of that.
Yeah, so that means that that vial can sit in there for quite a number of days. And that's a good, safe way to do it. You can just keep that tank at your clinic. You can keep it in your home. The only thing I would say is, like, don't keep it outside. Don't keep it in your car. Just kind of keep it in a vaguely comfortable temperature environment, and you can plan ahead. But if you're practicing your OPKs, if you're using a tracker, that can be super helpful. If you're working with an IVF provider, talk to them, let them know, like, when should I order the sperm? So everyone knows that this is the stressful part. So they will do their very, very best to help you out. And I've seen many times where Fairfax has gone above and beyond and made things happen so you can get that vial when you need it.
Mm-hmm.
Just ask.
Wonderful. Thank you all. Thank you to our presenters. Thank you to our listeners today. We hope everyone has a great Pride Month. And like always, feel free to get in touch with us if you have any questions. And we're happy to be here and to help you all. Thank you.
Thank you, guys. Happy Pride.
Thank you.